Dr. Salves, I told you that thyroid hormones control the speed of hair. The last two videos taught us about the importance of thyroid levels. What should you do if you have no symptoms but are diagnosed with an abnormal thyroid blood test? If it is obvious that you have hyperthyroidism or hypothyroidism, you should seek medical attention. Additionally, I state that in the event of subclinical hyperthyroidism, a thyroid stimulating hormone TSH level less than zero point 0.1 is a serious condition, while in the case of subclinical hypothyroidism, a TSH level of 7.0 or more is severe. Nonetheless, what should you do when your thyroid function is broken and you can't manage your speed well? There is a universal fact that applies to all aspects of health, correct? You must first avoid items that are bad for your health. First, be cautious about nitrate intake. It is used both in the canning process and as a preservative. It is also used as a coloring additive to make processed foods like ham and sausage seem red. And because it is employed as a chemical fertilizer, it may remain on vegetables. So, when you eat vegetables, you should wash them thoroughly, correct? Second, you should avoid smoking. It doubles the chance of Graves' disease, a prevalent type of hyperthyroidism. Third, you must avoid obesity, as it is the root cause of all disorders. Although hypothyroidism can cause weight gain, the opposite is also possible. Obesity can lead to increased inflammation, lipotoxicity, and leptin secretion, all of which can reduce thyroid function. Fourth, you should prevent infectious diseases. For example, Helicobacter pylori infection can boost thyroid autoimmunity and impair its function. Furthermore, autoimmunity develops if the fight against infectious diseases drags on for a long time. Should the battle drag on too long, the immune troops can start to perceive themselves as adversary. Stress is the fifth. It affects the thyroid gland adversary by way of the immunological or endocrine systems. It has a close connection to the thyroid gland's autoimmune reaction. It is specifically directly related to hyperthyroidism. On the other hand, there are likely some nutritional elements that are beneficial, correct? First, iodine. It becomes a component of thyroid hormones. Our bodies store 20 milligram of iodine, with the thyroid gland accounting for 80% of it. The recommended daily consumption is 100 to 300 microgram. 200 gram of chicken contains 160, and 100 milliliter of milk contains 80. Therefore, you may get enough iodine by drinking just 1 to 2 cups each day. Second, vitamin D. Deficiency can easily cause thyroid malfunction and increase the risk of thyroid cancer. Don't avoid too much sunlight, and if you are insufficient, consider taking supplements. Third, selenium. Tuna and sardines contain it, as do mushrooms, poultry, eggs, and beans. Eating just 50 grams of tuna will meet your daily requirements. In addition to nutritional content, there are several other factors that play a vital role in thyroid function. It is the circadian rhythm. Exposure to direct sunshine in the morning, obtaining around 8 hours of sleep at night, eating at regular intervals, and avoiding late night snacking are all critical for circadian rhythm. However, thyroid hormone secretion also has a circadian pattern. If you don't get enough sleep, your thyroid stimulating hormone levels rise. It will have a detrimental effect on functionality. Shift work between the day and night has a deleterious impact on the thyroid gland. From what we've studied thus far, it is evident that nutrients and immunity are essential for thyroid function. The body's most significant organs are depicted here. This is intestine. Our bodies have various axes that influence their functioning. You may compare it to a highway. The thyroid intestinal axis is one of these. Intestinal bacteria keep our metabolic rate moderate. For example, autoimmune thyroid illnesses like Hashimoto's thyroiditis and Graves' disease frequently coexist with autoimmune gut diseases. Intestinal bacteria support thyroid function via two distinct routes. First, it strengthens the barrier, reducing the likelihood of autoimmunity. When you consume enough dietary fiber, your body's microbes convert it into short-chain fatty acids. This modulates immune function and has anti-inflammatory properties. Thyroid hormone also help to build intercellular connections that form our body's protective shield. However, when intestinal microbes are imbalanced, intestinal permeability and inflammation rise, affecting the thyroid gland as well. Second, the gut microbiota affects mineral intake, which is linked to appropriate thyroid gland function. These minerals include iodine, selenium, zinc, and iron. No matter how many minerals you ingest through your tongue, if they are not absorbed, they are useless, right? Iron is required for thyroid hormone synthesis, as is proper iodine utilization. Iron deficiency is frequent in hypothyroidism and is identified concurrently in up to 60% of cases. Zinc plays an important role in thyroid hormone gene expression and helps them operate properly. For instance, eggs, oysters, beans, seaweed, pork, almonds, vanilla leaves, and mixed grains are good sources of iron and zinc. You need to eat them well while also working hard to consume dietary fiber. This is due to the proper balance of gut microbes. For reference, gut microbes require vitamin D to control immunity and thyroid function. So, consider taking additional vitamin D supplement or probiotics or prebiotics. You should also avoid simple sugar, fatty foods, and late night snacks that destroy your gut microbes in order to maintain proper thyroid function, correct? Now, let us try to order things to keep thyroid function, which regulates speed. You must first avoid five things. These included nitrates, tobacco, obesity, infectious illnesses, and stress. Conversely, nutrients to take care of were iodine, vitamin D, selenium, iron, and zinc. Also, the circadian rhythm, which must be maintained by sleeping well at regular intervals, was also significant. In addition, don't forget about intestinal microbes, which play an important role in thyroid gland regulation. Even when thyroid hormone levels are normal, there are usually no symptoms. However, even if hyperthyroidism or hypothyroidism is subclinical, the risk of cardiovascular disease or dementia increases. If you have abnormal thyroid levels, please follow the recommendations in this video and practice moderation. And don't forget about subscribe and like. Then, for the speed of your health, salute.